All right. Well, today's Echo Clinic will be a little bit different. Our training team will be leading today's didactic on team-based education and outreach. We're really aware of the state and federal landscape, and we're aware of the impact of these proposals to the people that we serve. And we will continue to advocate for these services to be supported within our state. The more that we can demonstrate the good work that we are doing and the numbers that we serve, and within our evaluation outcome, the better. So in order to support the good work that you are already doing, we really want to highlight the ways that your teams can continue to share the word about first episode psychosis and early intervention within your communities. So that's going to be the focus of our time together today. So let me switch over to sharing my slides. Thanks for bearing with me here. All right, so this is typically a topic that I review pretty regularly with our program directors. However, community education and outreach is really a team sport. It's important that all of our team members are included in these efforts in your community to help the larger community understand that what psychosis really is and what it's not. And then that allows us an opportunity to begin instilling hope in our own agencies and within the larger community in which we serve. We want to share the good news that experiencing psychosis isn't a diagnosis of doom, rather that we each play a role in providing hope that recovery from psychosis is possible, and our teams have training and resources to be the guiding light to help people on their journeys. So as we think about the goals of doing community education and outreach, we really are trying to decrease the duration of untreated psychosis, or DUP, within our communities. We want to increase awareness of first episode psychosis, educate people that recovery is possible, begin combating the stigma associated with schizophrenia, bipolar disorder, and psychosis, and really begin to develop and manage a referral network so that we're getting a nice flow of referrals to our teams. When we think about those referrals, this is a image that I stole from the larger CAPS work when we were thinking about having thinking about the larger screening efforts that we were proposing previously in the year. But when we think about this path, I think it's a nice visual, because many people who experience psychosis may go long periods of time without accessing care. There are a lot of reasons why that may occur. Maybe stigma or isolation or withdrawal from family or society. Yet for others, there may be like this ping pong effect that occurs when care is needed. People may present to the ER or crisis services, have police encounters, endure involuntary hospitalizations, which may include some pretty adverse treatment experiences. There's a lot of inaccurate messaging about these illnesses, which may result in stigma, a lack of hope in the future, which realistically may negatively impact help-seeking behaviors. All of these things may contribute to an increase in duration of untreated psychosis and may delay somebody's access to care. Our job is to provide accurate information about psychosis and the alternative path that New Journeys offers at any one of these points where someone is coming into contact with the system. And that hope would be that we can help at any one of these points an individual be routed to New Journeys sooner in the course of their experiences. So when we start having these conversations in the community, one thing that many of you may run up against is the need to talk with other teams and organizations outside of your own about the benefits of making a referral to your New Journeys team rather than keeping folks that are in their typical community care settings. The reality here is that models like New Journeys are the gold standard of care for psychosis. When somebody is experiencing a cardiac event, they're referred to a cardiologist. And if somebody has a new onset of diabetes, they're sent to an endocrinologist. In the same way, it's our job to encourage other providers to refer those experiencing a first episode of psychosis to the right fit care, which in this case is coordinated specialty care, which in Washington is called New Journeys. So here are some ideas of places that you can go to begin providing community education and outreach. We want to think about where these young people are most likely to be spending their time and who in those places may be most likely to first identify that something is going on for this person. So primary settings can be places like inpatient facilities, emergency room, crisis services, other outpatient services within your region, as well as within your own agency. We can think about family organizations or primary care settings. Secondary referral sources may be places that the youth are spending the most time, school. Um, Transitional age youth programs may be places that are serving people through juvenile justice or criminal justice systems, maybe diversion areas as well, maybe even substance use disorder programs that are serving young people. And then we have the tertiary, where we would think of like places of worship, libraries, community and recreation centers, radio, TV, newspaper. I know some of you have even reached out to places like dental offices and things like that. So aside from these potential referral sources, there may be other interested parties within your regions that would be helpful to partner with. Sonia is going to provide some more ideas about places to connect with later, but I also want to point you toward a list of community events and organizations that the WACEP has compiled across our state. There are a lot of opportunities to begin getting creative and plug into existing resources across our communities. So this is something that I actually was talking with Kyle and we kind of conceptualized. When you're going out into the community and meeting with different organizations, it can be important to consider what kind of messaging we need to be providing to that organization. Sometimes you may be simply orienting to the larger services provided by your agency. In some of your regions, you may be going out into the community and have this larger task of creating repairs within the community on behalf of your agency for organizations or individuals who haven't had great experiences with accessing services there. In this sense, maybe your task is to simply build a trustworthy relationship on behalf of your agency and provide accurate information on who can access services at your agency and how they do that. Once that kind of trust has been more established, you may move into a different phase of education about psychosis at large, best practices for first episode psychosis care, and then orientation to your larger New Journeys team. This is something that is done maybe in one session, or it may be something that's done over a period of time, depending upon who you're talking to.
Yeah, just a quick note here that, as Cammie mentioned, there's lots of different types of community education you might engage in depending on the level of relationship you have with that individual or that organization. But throughout all of them, it's just really important to remember that one of the central goals is breaking down stigma. I'm sure you've all seen how schizophrenia is portrayed in movies and TV shows and in society at large. And we even know that clinicians who aren't necessarily in the psychosis field often have a huge lack of knowledge as well and might carry stigmas. I just went through my master's program a couple years ago, and I can attest that there was very little information on psychosis. I'm sure many of you may have experienced similar things in your programs. So we really just want to provide accurate information to help lower barriers for people to getting into the right care for them. And this it can even include like providers who've been in the field for a long time and might be talking to prospective clients in ways that kind of put them off care or put them make them more distrustful of the mental health system. So just want to make sure that that's one of our central goals is helping people know these things that psychosis is not as listed on the right side here.
Okay, so hi everyone. I really do appreciate uh, both Cammie and Mackenzie's advocacy towards this subject. It certainly is one important aspect that I believe needs to be focused on at this time. But more so to get down to the brass tacks, your role versus the larger New Journeys mission. So your role is likely one that is incredibly important to you and to the person you're serving. And so we want to make sure that those services are available to all clients. Not necessarily are they going to decide that they want to be involved in all services, but it is important that we make sure that they're educated on what the team can offer, because comprehensive is a part of the term. because it should be wraparound care. It should be trying to understand what the needs of the person are and how we're going to get them to those services, even if it's through simple rapport building or just interacting, engaging with that person in their environment. And so assisting with all aspects of establishing education and employment is really my area of expertise within comprehensive specialty care, and making sure that a person is not excluded based on really anything. If all they really need to do is say, I want to work, and the person in that position will be happy to assist them with their academic or vocational aspirations. And the services are provided within the community. And that's really a key part in understanding how this is going to work. Really just being out in your community and providing a sense of advocacy, especially in between times of, slow referrals or whatnot. It's really important to canvass and really inform in regard to your program. And through that, you will build those resources within your community, construct alliances, make sure that people are aware that you exist. I can't tell you the amount of times that I was told by somebody, I'm so glad that I found out about this program. I don't know what I would have done without it. That comes up, had come up more often than I would like to have admitted, because that means that not necessarily we, but the advocacy for the program needs to be at its peak for those times, especially. And then educating in regard to the program is an incredibly important aspect of that canvassing, and knowing what your team offers and being able to advocate for those services within that education. And you're really demystifying common negative association, right? That we're looking to just reduce people's assumptive understanding of what this illness is and how these symptoms can affect a person's lives, as well as the disabilities that are caused by those symptoms. The disabling factors can impact everyday life, in fact, from the moment they wake up until the moment they go to sleep. And helping a person navigate around those associations, right, and saying they believe that a person, etc. We want to make sure that we're taking the time to listen and not be combative, really just to inform and not necessarily correct, and really just treating it gently as you move through your community and understanding where you're at, who you're speaking with, what their intentions might be, and what they may be able to do in order to help a person that is within your care meet their treatment goals. The outcomes for individuals in new journeys are always in sight for the team. This is certainly an incredibly important part of it, where we want to make sure that people are understanding the different aspects of care and what, as as Mackenzie said, what psychosis definitely is not. And collaboration, right, with these local businesses or wherever you're reaching out to, every community is different. And so there is no template more than the overall structure that is trained for community engagement, that you will just move within your community as you know it. And if you're new to your community, well, that spells a need for you to learn a little bit more about it or where things are. I mean, it really is, you can learn about potential resources through resources that you engage with. And furthermore, the relevance of your program. Why is it important? There's an underserved population here that is widely misunderstood, that we need to make sure that the advocacy is at its peak and that we're giving people information that absolutely is correct and allowing, right? We want to make sure that we don't feel like there's a gate to new journeys. It's for those who are experiencing the first episode and are introduced to interventions through this comprehensive specialty care. And very important that we advocate, because this may be a person's first treatment team experience, or maybe even their first experience with the mental health care system. So all these elements collectively mean that comprehensive specialty care should be well known throughout your community, at the very least, for those who might interact with those who are experiencing first episode. And so when we're partnering in the community, establishing those alliances, we're talking about participant outcomes here. When a person enters a program, they're looking for a certain piece, or we're helping them establish that certain piece even. Sometimes they come in with their own aspirations, which we help them meet. Furthermore, we want to make sure that those determinants within the community, so we aren't introducing somebody to an area within the community that they may not feel comfortable or they may not be oriented to, so that they can actually move about with confidence. And really that is, we talk about quality of life outcomes, and quality of life just means that the person feels autonomous to a degree and maybe feels that they have more freedom within their community because the comfort or at least association and assimilation with that community has been implemented, and they feel like it's more of an open door, right? You want people to feel like they're comfortable in their communities as much as you want to yourself. And these considerations that we take in are for positive interactions with cultural aspects, and the cultural aspects of your community again are going to be respective to your community. So learning about those and working with those and also understanding them really is I think through the lens of the person that you're serving is a important aspect as well, and really will help with those improved outcomes. And throughout supported education and employment, it is part of the evidence-based practice to strengthen rapport and build those alliances within the communities. I talk about community programs, or excuse me, community organizations such as the YMCA that are generally widespread. But if there isn't one that exists such as that, it's really important that you identify those, or at the very least, bounce referral off of one another within your team or within your agency to find out if there's more resources or otherwise that can be offered to your participants. And then lastly, the strategies that you utilize to build trust with a person. It really does come down to how you interact with them. And, when you're coming to a community, when you're going out to orient yourself into a community, you really want to think about how can we work with this person, not necessarily what resources can they offer. We want to think about it as a collaboration, not just a resource. We want to be able to continue to tap into that resource. And a big part of that is maintaining that conversation about the helpful aspects of that particular collaborative, I guess, organization or otherwise. But it really does mean a lot to go out into your community and explore what the overall stigma might be, and helping to reduce that stigma by, again, demystifying some of the misconceptions that come along with first episode psychosis.
So many of you are already spending time in the community as a part of your day-to-day tasks at work, like Kyle was describing. Our goal in talking about community education and outreach as a team-based effort is not to create yet another thing on your to-do list. Rather, we want you to each develop the skills to share the information in the places that you're already in. We want your team to work together to encourage a healthy flow of referrals to your team and ensure that those who need access to care can be routed to you in a timely manner. We also know that community education isn't a one-time deal. There is turnover in our field. If people aren't referring regularly, we may fall off of their radar. So it can be important that these kinds of efforts really become less about providing the information to others and really more about building relationships and creating an opening for our community to feel aligned with our team's mission, values, and goals, like Kyle was describing. By engaging your entire team in these efforts, you're offering a number of different perspectives about the same topic, which may allow for more opportunities for somebody to feel aligned with the messaging of your team and really put a face to the message that you're providing, making it more memorable when they do need to reach out. From my own time working on a team, I remember having numerous people who would just call me after doing an education and outreach event or presentation or something like that, and they would just ask for time to consult with me. And by making myself available to consult with them and answer their questions, it really did start to shape the referrals that my team received. So since our teams are already providing community-based care, this style of outreach and education can also provide those that we're working with insight to how we pursue engaging with those whom they refer. If they feel like we are trustworthy and reliable, they can relay that sense of trust to the individuals that they may be referring.
Just a quick note on fidelity here, as I know we're starting our fidelity reviews. We thank you to BHR and CMAR Vancouver and STEP and Comprehensive Yakima. So I don't want you to get too bogged down on the details here, but as we've mentioned, our fidelity tool that we're using was developed by Piper Meyer-Kalos and her team at University of Minnesota. We've been working closely with them to adapt it to our Washington context. So there is one item on community education. It's on the top here, and a possible adaptation that we're still kind of working out the details for is on the bottom. And the main thing I want you to take away from this is that the more you're doing community education, the higher the rating. So if your team is full or close to full, we'd want to see you doing community education at least 6 times a year. And if you're struggling with caseload a little bit, not quite full, at least 12 times a year, so about once a month. And you might wonder why you would need to do community education if you're full or close to full. And we really think it's beneficial to maintain those relationships and partnerships and keep them strong and alive so that you get those referrals once you do have slots available. And then, as I talked about before, because a big part of community education is decreasing stigma and increasing knowledge, those are relevant throughout the year and irregardless of your caseload. So just wanted to put a note in there for fidelity.
All right. Community outreach and engagement is so much fun. It's so much fun to get out there and meet people and talk about the good work that you're doing and to learn about the good work that other people might be doing if they're part of different, agencies or conduct private practice. And then also people, that are members of that are part of the community. And we wanted to help kind of make this a little easier. Our team recently did the NAMI walk. We had a table, we set it up, and we're able to talk with members of the community, other people that were, part of mental health groups. And these flyers, so we have flyers that are available to you, were really helpful as kind of talking points. So if you don't know where to begin, as you're talking with folks, it was really easy for me to kind of point to some of these flyers. It's easy to kind of give a brief overview of some of the services that are available with New Journeys, and then also some of the inclusion criteria. People would grab these, they can scan the QR code, and that'll be, sending them directly to the New Journeys website where they can submit a referral. Do you mind going to the next slide? We also translated some of the flyers into 9 different languages. These are the most common languages that are spoken in Washington State. So these are also available to folks, again, who speak and read these languages. Go ahead, the next one. And then we have psychosis fact sheets. So this is, what causes psychosis, examples of psychosis. So for some folks that you're going to meet, they're going to speak the language. They know, they talk the talk and kind of know the field pretty well. And for others, they kind of need a psychosis 101. And this is a really helpful tool so that you can give folks that knowledge. We had some students come up to our table. So this was just really helpful to just answer their questions. They can, again, scan the code so they can learn a little bit more from the website. But for folks who have kind of those basic questions, these are nice fact sheets that are available as well. Go ahead, the next slide. All right, and then we have a social media toolkit. So this shouldn't be new. If it is, let us know and we can connect you. I actually have the link that I'll send after the slides so that you have direct access. If you need us to email those because there's restrictions with drop boxes, that certainly happens. Let us know. We can just email you the different kind of social media templates that we have. The next slide. So this gives an overview here of, what you can do with your social media. We also have posts that are ready to go that you can post on your website or on your social media platforms. And then we also have a template that you can use that you can modify and customize your social media posts. I know social media can be a little intimidating. It has been for our team. Like, how do we post things? What do we say? How do we do this? How do we do this where we don't look like super square to the folks that are kind of reading this? So we're happy to connect with you at any time if you want help to kind of think through, like, what should we say or what should we post or is this okay? We're happy to think through some of those things. Believe me, I've had to lean on our team. I've had to lean on some of the more younger folks to give us a sense of, like, is this okay? And I've certainly been given the, please don't do that. That's not going to fly. So we can certainly lend our knowledge and expertise that we've been learning, again, from folks in our lab. We've also reached out. We've got the Belief Agency. So if you know the football Seahawks, we are 12. That's the same agency, and they've helped us with our public mental health campaign. And they've also given us these instructions. And if you have any questions, we can loop back to that group to get some expertise and expert responses to the questions you might have. So definitely don't be intimidated. Get out there, get the word out there. And again, it's so much fun. After the events we've done also, it's a great team building activity. We left that and just felt really wonderful. And then we got to hear different pitches from, different folks. So Dr. Kapelovich, gave kind of overview as she's talking with folks. And so then I was able to adopt some of the things that she did. And I know John, we went back and forth a little bit about, like, how do we, how do we approach this with folks? How do we start the conversation? And so it's just a wonderful activity. We all felt great about it afterwards. And again, we made some wonderful connections with different organizations and members in the community. And I think we're able to give those resources to folks who then we're hopefully able to use them. Okay, I think that's all the slides for social media and flyers and anything else. So again, reach out if you need help accessing those tools.
Thank you, Rachel. And I'm seeing a lot of comments in the chat box about just how to access those. So I will go over that in the next couple of slides. And then, as Rachel said, if you have more questions, please reach out to us. So some additional resources, we have this amazing PowerPoint deck template that really has all of the basic information about what psychosis is, what New Journeys is, and how you refer. I have used this with our community partners, and it's really, for me, it's really the perfect amount of information. It has all of the things that you need to understand the basics without getting too in the weeds. And so I really recommend using this. It's a really great way, I think, of reaching community members. And then, of course, you can add your own contact information at the end. And next slide. Thank you so much. So another new resource that we're going to have coming out in the next couple of weeks is our psychosis care guide. We're really excited about this. We put this together over the last couple of months with the Belief Agency. And this is supporting community leaders, medical providers, and educators to understand how to talk about psychosis when it comes up, how to refer individuals to care, and how to continue to support them in community even as they're accessing that referral. And so this will come out in the next couple of weeks. You'll see it up on the portal, but I think this will be a really wonderful resource that you can share with your community partners. Next slide. So there is an amazing recording. Oh, are we going to play it? No. So this is Cammie's recording of the slide deck that I showed you a couple of slides ago. This is really fantastic if you are, let's say you're emailing with someone one-on-one and you're not going to be able to do a community presentation to their entire group, or they don't necessarily want that, right? This is something that you can send them that will be brief, that they can watch on their own time to understand what psychosis is and understand what New Journeys is. I think it's a really great dissemination tool, and I really suggest sending that out to folks. And next slide. Okay, so this is the question about accessing all of our materials. So you can go on to the New Journeys website. Up at the right hand corner, there's the member login. You can put this password, which is just New Journeys 15, and then go over to our resources tab. Next slide. So then someone was kind of saying the file paths in the chat box, which is really helpful. So all of these resources are in the community outreach and education, except for the PR toolkit that I showed you a moment ago. That will be up in the next couple of weeks. It's not there yet, as we're finalizing the design with belief. But everything else will be there, and you can poke around and find everything, download it to your personal device and share it with folks. Next slide. So this is a community outreach and education strategic plan. This comes from the Navigate Directors Manual and is really what we need to do as directors within the first year to set up our outreach plan. And so I have found this really helpful, kind of starting the SEH program, to think about the steps that I need for developing our outreach plan. And it's just a nice guide to be able to walk through. And I think with that, I'm going to turn it back to Cammie.
Thank you. There's just a lot of really great stuff that's been created for all of you, and so I hope that you'll utilize it. And if there are things that you'd like to see that you don't see, please let us know that as well. And Cameron has been just great about creating things that we need. So thank you. I want to just make sure she gets a shout out for creating a lot of that material, and as well as to the Belief Agency and others on this call. So part of being a trustworthy and reliable resource is having strong follow through when referrals or requests for consultation or more information are made. So we want to strive for responding to all requests within 3 business days. This may mean that you need to have a plan for coverage if your program director is swamped or out of the office. I would encourage each of your teams to create a coverage protocol and pursue opportunities for cross training to ensure that there's responsiveness across your teams and for those that you serve. We also want to think about responding to UW. If we're routing a referral that comes through on the website to you, if you can just make sure you're letting us know that you've received the referral that has been routed from the website, and then also updating the caseload and waitlist form, which helps us to be aware of where we should be routing referrals based on your own availability for accepting new referrals. But the main point here is that we always want you to be following up. So even if somebody's not eligible, make sure you're closing that referral loop by providing resources for care, and also consider reaching out to the referral resource or referral source that has sent the referral to you to talk through your admission decision. This can be a real great opportunity to begin shaping the referrals that you receive by providing feedback on the referral and providing information about what you saw going on, if you did a differential diagnosis or anything like that, to really help to maintain those healthy relationships within your community. When somebody is not eligible for New Journeys, I want to make sure that everyone is aware that we have a resource that we want to make available to you, and that's our referral database. This database currently holds over 7,000 providers from across our state, and we can continue to develop this resource as we speak. We've spent over almost 1,000 hours developing this in the last year. So when you have somebody who is not eligible for your team, feel free to complete the form that's on this link, and we can help curate referral resources and confirm availability of those resources as you send us requests for each specific individual. And I'm going to pass it to Sonia.
Thanks, Cammie. This is Sonia from Healthcare Authority, and I wanted to acknowledge that I know some of the New Journeys teams are not fully staffed, and I know that can impact your team's ability to do a comprehensive outreach in your community. And then I think, as Kyle was saying, if you're new to the work or you may have even moved to a new area, and getting to know what resources exist within your community and building relationships can take time. So every situation is different, and I'm really grateful to the University of Washington for leading the charge on creating all these materials to hopefully at least give you something to work with. But the building relationships part takes time, and if you need support with that, don't be afraid to reach out and ask. At the Healthcare Authority, we have relationships with various regional providers and entities that we'd be happy to provide a contact with or just introduce you. There's also a lot of things happening all the time, and I'm sure some of you are well aware of this and probably already involved, but a good place to start in your region, if you're not already a part of it, is the Kids Mental Health Washington Initiative, which is also called the Regional Behavioral Health Navigators. And those are set up in each BHASO region. And their role really is to help coordinate care for individuals, young people with complex needs. But they work a lot with hospitals, with the crisis teams, and I think it would be great for New Journeys to have a presence there as well to get referrals for individuals with first episode psychosis. And I know some of you are already doing that, but if you would like help reaching out to your local kids mental health team, feel free to let me know and I can help get you connected. The youth mobile crisis teams, in the past couple of years, the state has done a lot of work to stand up youth specific crisis teams in every region. I think there's 18 now across the state of Washington, and their role really is to respond to crisis in the community. And I think that would be another great resource to develop a relationship. So if they are called out to a crisis and, somebody might be exhibiting potential symptoms of psychosis, to be able to make that referral in the community, make a warm handoff. Another entity, it's called the Regional and Statewide Family Youth System Partner Roundtables. And it's part of the system of care governance structure in Washington state. So they convene in regions, and usually there's youth representatives, family partners, and systems representatives that go there. And they talk about what they see going on in their community, what the gaps in care are, what the needs might be, and then they can elevate that up to the state level and up to the Children Youth Behavioral Health Work Group, which is a legislative body. So that's a great way to get involved in your region and advocate for what you see going on in your community, as well as just educate about first episode psychosis and the resource that your team can make available. So I mentioned the Children and Youth Behavioral Health Work Group. People from the community are able to attend that, and now is a really good time to be advocating and sharing what you see going on in your community and the need. They're engaged in a strategic planning process right now, and I think I've told some of you about this. It's called Washington Thriving, and I can send out information. And they're looking at the landscape of children and youth behavioral health services across the continuum of care, and what our state really needs to be doing to invest in more comprehensive care and making sure that we have the right resources available in communities. And I've attended some of these sessions, and I get the sense that a lot of people are not really that aware about first episode psychosis or about New Journeys and the work that you all have done to build this network. And so if you'd like to get involved, I think it's a good time to do that. Another group that meets regularly is the Mobile Response and Stabilization Services Work Group, and these are mostly consisting of providers and ASO representatives to talk about crisis care in the community. I think there's also a wraparound with intensive services collaboratives that you might want to try to get in touch with. I know some of you work for agencies that have robust WISE programs as well, and I'm sure those are good resource for referrals. For those of you who are in contract with the MCOs, sometimes, being able to share information with the MCOs about what services you're providing can be helpful, because I think, the structure of those organizations is so large that, and they have so much turnover that I don't think they're always super well informed. So HCA, we can help facilitate ongoing education and communication with them as well, and with the regional BHASOs. Well, I have two more. I have a lot, but I don't know if any of you are aware of they're called Community Prevention and Wellness Initiatives, or CPWIs that really work on prevention. But I think, again, that's a good place to educate about psychosis. And they do a lot of non-treatment related activities and educating families about mental health and substance use. And they put on a lot of events and trainings, and so it might be a good place to connect. And then another one I wanted to point out, I think would be really helpful for the peers on your teams to get involved. It's called the Lived Experience Subcommittee that was formed as part of the 988 work for crisis. And so they were providing information to the legislature, giving recommendations. And so that body is created for and by people with lived experience. And so it's I think it would be a great forum for peers on the team to go and share information about new journeys. I've been in attendance to those for the past couple of years, and people from the community will come on and they'll kind of talk about, they're frustrated, they're looking for help, but they don't know where to turn, or they just don't know what resources are available. And then also it's an opportunity to advocate for the work that you're doing. So if you would like to get connected or more information, I'll put my email in the chat. And at the Healthcare Authority, we're happy to support you if you feel like you would like that. So thank you.
Thanks so much, Sonia. Those are really valuable resources, and I really appreciate you being able to connect our teams to them. So we're going to do a brief small group discussion in breakouts just with team members. Won't have trainers in there. We just really want to give you a chance to talk about how this is going for your teams. So we put 3 teams per room. One room has 4 teams. And the questions that I wrote to guide your discussion is just how are things going? Who on your team is completing community education and to which audiences? And are there groups that you think you're missing that you'd like to connect with? So Cammie did a great job laying out a lot of different ideas of groups to reach, but I want you to take some time to brainstorm if there's gaps in who you've connected with that might, be seeing people with first episode psychosis or be connected to people that might benefit from being referred. And then what barriers are you experiencing? So we've heard from a couple of teams that there are some regions where certain programs are, I don't exactly know how to phrase, are seeing people who may benefit from new journeys, but are holding them in different programs for all sorts of different reasons and are not referring to new journeys maybe because of a lack of knowledge or because of, more political or relationship type challenges. So are those barriers you're experiencing, and how might you work around some of those barriers or, brainstorm some possible solutions? And then are there resources that would make any of this easier? Is there anything we can provide or make or find for you to make any of these conversations easier or outreach at all easier? And then please identify someone from your group to share out. And we'll have some time to do that afterwards. I'm going to have you in breakout rooms for 10 minutes, and I've labeled them with the teams assigned to each room. So you can self-select because there's a fair bit of in and out on these calls. So I wanted to make sure everyone could do that. So I'm going to open the rooms and you'll hopefully see the options here and you can self-select. So we'll see you in 10 minutes. All right, I think we have everybody back at this point. So hope your breakout time was interesting or productive. I wanted to open it up if there's anything that you felt was interesting that you wanted to share with the broader group, anything other teams might benefit from hearing about. Yeah, anything anyone wanted to share from breakouts? I can go group by group if that feels better too.
Yeah, let's just hand it over to group 1, which was Lucid Living, Pasco, and Seymour and Snohomish. What were your takeaways from your discussion?
We kind of just discussed the various places we've all kind of done outreach to, just different agencies in general of mental health, police, fire departments, the various coalitions, FISPER, various SUD agencies as well. I know us specifically, we've had a difficult time with getting referrals, even though our case manager and us, we've been really pushing to do a lot of outreach, especially in the last couple months. But we did reach out to the world refugee individuals and kind of spread the word there, and just the various school districts and the counselors through there. But it's still kind of that disconnect, us doing the outreach and then not really receiving the referrals after. So that's just something we've been struggling with.
Dr. Greg's computer died, but what he was saying before that happened was that we need to get creative with kind of how we're engaging these partners, and that engagement can't just begin and end with an introduction of services and a meeting. It kind of has to be an ongoing correspondence between us and these various organizations that we're getting referrals from. So there needs to be like, check-ins periodically with them and call them every now and then and see how things are going and kind of remind them that we're there as a resource, and to kind of just remind everyone to continue the outreach efforts with their specific partners. Even if they haven't been getting referrals from them, just keep at it, keep trying to engage with them and remind them that.
Muted at the end there, but I think you may have been close to the end of your sentence.
Yeah, just sorry, just that just to remind, make sure to keep having correspondence with these organizations and these individuals, and not just, start with or, end with um, introducing our services and then just kind of hope that they will remember us in the future to just like keep on.
Thanks so much for sharing that. I think your audio was a little up and down for me, but I think we got through. So that was really helpful. Thank you, Stevie. Just for the sake of time, I was wondering if anyone else had anything they wanted to bring up instead of going through the rest of the groups, so we make sure we have time for our last section here.
Yeah.
Any other?
Feel free to just drop it in the chat too. Yeah.
To them and keep checking in with them, and I think that been helpful for us in getting referrals. It's just that we keep
Whomever is talking, we're having some significant breakup and kind of slowing down.
Yeah, let's go ahead, and if you have additional feedback from your time together, let's go ahead and just drop that into the chat, so we can do some shared learning and send out some notes after this, around what's been working or other areas of opportunity for other people. And I'm going to hand it over to Melissa, and we're going to think about elevator pitches.
Great, thank you. So in Minnesota, we like to talk a lot about elevator pitches. One as a means to introduce yourself to potential referring sources, kind of get the word out about what you do in the program in a very short, concise way, as well as also using elevator pitches. You can use them when engaging individuals and families in your programs too. So when we think about an elevator pitch, we're going to give you, I don't know, 3 to 5 minutes maybe here to talk, for you to take some time to just think independently about what you would want your elevator pitch to include. There's a graphic here on the left of the slide just to give you some guidance on what you might include in an elevator pitch. I like thinking about pitching both the program as a whole as well as the role that I specifically work in. So what I might say is, hi, my name's Melissa Delho. I'm really excited about having an opportunity to meet with you. I'm a family clinician on one of our Navigate teams in Minnesota. I help support individuals and families impacted by psychosis. Navigate's a team-based approach. So I'm also work alongside several other team members, including someone who provides med management, individual therapy support, work and school support, etc. I'd love an opportunity to, talk with you more about the program or schedule an appointment, for example. So always having kind of an ask at the end. Um, I also think it's helpful to know, kind of in the long run, know the elevator pitches of all of your team members. You never know if you'll be out in the community representing your program and other team members, or if you'll be meeting with an individual like client or support persons, and you have the opportunity to pitch another team member's services. So elevator pitches can be really helpful in that way. So we're gonna give you, Cammie, how are we doing on time? Do we want to do 5 full minutes?
Let's do 3 minutes.
Okay, so we'll do 3 minutes starting now. Maybe we can leave this slide up. And we just want each person on the call to think about what you would want your elevator pitch to include. If you were talking to somebody out in the community who might refer, or you can also think about it too as if you were talking to an individual or family in your program. Would you like me? Oh, there we go. Perfect. All right, so I'd wrap up any kind of final thoughts that you have about your own individual or program elevator pitch. And then what we'd like to do, and Cammie, correct me if I'm wrong, I think we're going to open up breakout rooms according to team member role so that you can, no.
We're going to do them by random.
By random. Okay, perfect. Then we'll do them by random and you can all share your thoughts in that way as well. So we'll move to those breakout rooms now.
Great. I'll open those up. They'll be open for 7 minutes. Let me just running a little bit low on time. All right, breakout rooms, you'll be moved automatically, and feel free to come back out if you have any questions.
Just have a few minutes left. Rather than having each group kind of report out, we'd like to open it up to see if anybody had any challenges or questions about the elevator pitch that we could help address. Otherwise, I wanted to give one suggested activity for you all to follow up on, which is to, in your next team meeting, share with each other what your elevator pitches are, both for the program as well as each of your roles, because I can't emphasize enough, you never know when you're going to be pitching one of your colleagues' services for support. So it's good to be familiar with each role's kind of elevator pitch. Anybody have any challenges or questions that came up? I'd say it's pretty straightforward. It just takes practice. Eventually, you'll rattle it off in your sleep once you get an elevator pitch down. Yeah, repetition is key. All right. Thank you.
Well, thank you all for your attention today. Our hope is that you feel a little bit more equipped to go out and do some community education, or at least talk about new journeys in your role, recognizing that we all come into this field as mental health clinicians or interested in mental health, not necessarily in public relations. And so it's a little bit of a stretch for some of us and putting on a little bit of a different hat. So we do encourage you to role play with within your teams to talk about this within your teams and make sure that you're sharing your pitch with other team members so that they can become more familiar with how to talk about these things. If there are questions or anything like that that come up, please let us know. Otherwise, we will see you on your monthly consultation calls in July. Believe it or not, we're going into July. So happy 4th of July to those of you who celebrate, and we will talk to you all soon. Bye, everyone.